Hello and welcome to today's show. I'm Jamie Smith, the Cancer Control Specialist with the Kentucky Cancer Program. Today we're going to talk about skin cancer and skin safety, and joining me today is Dr. Evelyn Jones. Welcome to today's show and thanks for joining us.
Thank you, Jamie.
If you wouldn't mind maybe just kind of starting out and telling us, you're obviously a Paducah native, so tell us your journey into their medical field.
Well, I am. I graduated from Tillman, so I'm from Paducah, and went to Georgetown College. And then in Louisville, I went to medical school and did my dermatology training. And then started my practice in dermatology here in 1993. Do a lot of general dermatology, surgical, some cosmetic, and have skin products we recommend to improve the health of the skin. See adults and children and men and women. So,
well, I know today we have plenty of stuff to talk about, and I know that there's lots of questions people have, and hopefully we'll be able to cover all those. First of all, I guess let's just start talking about risk factors for skin cancer.
Really, there are obviously the genetic tendencies that people will have, and part of that is controlled by if your family members have had skin cancer, you're going to have a higher risk. Also, some of the genetic tendencies, if you have light hair, light eyes, a tendency to freckle when you're out, if you have a large number of moles. So those are the more inherited factors that you really can't control.
Right.
And then there are the environmental exposures that we have that will definitely increase the risk that we do have control of, and that is the amount of sun exposure that you have over the years, accumulated sun exposure. If you have had blistering sunburns or just plain sunburns, your risk is increased dramatically. And then any kind of tanning, just color from either the sun or any exposure to tanning beds will significantly increase your risk of skin cancer.
Right. And that's one thing we were just talking about earlier is, you know, some people really think the beautiful tanned bodies are what is beautiful and what's in, and actually, just kind of like what you just said, it's actually just a scar on the body then from the sun, right?
That's right, a lot of detrimental effects. Really, if you look at the timeline of tanning, years ago, fair skin was what was considered attractive, and that's what people wanted. And it's interesting, it was Coco Chanel who was on a steamliner back in the early 1900s who accidentally fell asleep on the deck and got a tan and arrived back in America tanned, and that's what started the new desire to have a tan. But we are hopefully getting back to the fact that normal skin and non-sun damaged skin is in.
Yes, that's definitely what we want people to see. So 90% of all skin cancers occur on sun-exposed skin, is what literature says when we often read it. So the face, the neck, the ears, the forearms, the hands is what we would consider the most common areas. Is this what you see in your practice as well?
It really is. Now, one change that I have seen in the last probably 10 years is that sun-exposed areas are changing with lifestyle clothing changes. Right. So more skin is tending to be exposed to the sun, and so we've seen a little bit more area than we would typically. But one blistering sunburn in childhood or adolescence is going to increase the risk of melanoma twofold. So being protected on a daily basis is so important on all the sun-exposed areas that you have.
And what do you recommend to your patients for protection?
What I usually tell people is if you put sunscreen by your toothbrush and toothpaste, so every morning you put sunscreen on any areas that are going to see the sun. So face, neck, anterior chest, ears, arms, hands, and then depending on what clothing you're wearing, to have protection. And usually I recommend at least a broad spectrum, ultraviolet A, ultraviolet B, at least SPF of 15 to protect the skin, so you know you have that all-day protection.
And a lot of people may not know about the UVA and UVB rays and what exactly they are. So maybe we could take a few minutes and just talk about those specific rays and what they actually do. So the UVA, one thing that we always tell people is just remember A stands for aging. So maybe you could tell a little bit about what the A rays would do to you from exposure.
Okay, the ultraviolet A rays penetrate a little bit deeper in the skin, and they really do cause some of the aging, but also they cause the tan. And so initially, like with tanning bed industries, they would say, this is ultraviolet A, it's not going to damage your skin, it's just going to give you color.
Right.
And that's not true. We know that ultraviolet A increases the risk of skin cancer just like ultraviolet B. The ultraviolet B light really gives you more of a burn because it's more intense. it will get a damage effect on the skin quicker than the ultraviolet A. So it leads more to getting a sunburn.
Right, okay. Well, I guess let's move now into the actual, you're exposed for several years and maybe you have some spots that you're concerned about. We'll talk real briefly about the different types of skin cancer that may occur on your body. And so first of all, let's just start with basal cell and let you talk about that.
Okay, well there are really three main types
Right.
of skin cancers. And there are the non-melanoma skin cancers, which are basal cell and squamous cell. And then there's the melanoma. So the basal cell is usually a flesh-colored bump on the skin. It has kind of a pearly or translucent border, as you can see. Sometimes there are little dilated blood vessels that run through the area. It's really not a place that people notice many times because it's not painful, it's not tender, and most of the time. The nice thing about basal cell is it does not spread, so it is not a type that we worry about as far as death from basal cell, but it can be very locally aggressive and even invade the bone, so it can be disfiguring
Right.
to people.
Okay. And so then the next one that we'll probably talk about would be squamous cell, and you can maybe see that picture as well. And
Yes, this is a squamous cell carcinoma, and we see this a little bit later in life than we do the basal cells. Typically, it's a firm red bump or nodule, and then has a crusting cap to it. They can be a little tender, and usually are a little bit tender. They're responsible for 1/4 of skin cancer deaths. So we do want to watch those and protect against those. If we talk about just those two non-melanoma skin cancers, the basal cell and squamous cell, they have really been dramatically on the rise, and they are the #1 cancer in the world diagnosed. And about 1 million cases of those we'll see in America within a year alone.
Right.
So 1 in 5 Americans will get a non-melanoma skin cancer.
And skin cancer is the most common type of cancer that occurs.
Yes.
But it's just, you know, if they're those early ones, then they're the most treatable, of
Yes.
course. Then we can talk a few minutes about melanoma, which is often the most deadly type of skin cancer.
Yes.
And unfortunately, you said that you have been seeing more and more of melanoma. So there's a picture of melanoma, and we'll let you talk about that for a few minutes.
Yes, melanoma rates have dramatically increased in America recently, mostly due to significant tanning. We see a dramatic increase in young women.
Right.
Melanoma can start as a melanoma from the beginning, or more commonly, it starts as a mole that with sun exposure develops changes. And so we look for the ABCDs of melanoma. That's what everybody talks about. And what that stands for, A is asymmetry. So for that picture right there, if you draw a line through the middle of that, one side is different than the other. It's not a symmetric lesion. B is border. The border is fuzzy, irregular, scalloped. C is for color, different colors, or very dark colors. For instance, that lesion, if just that darkest area was there, you would still be worried about that. And then diameter is the most really not significant of those four things that we look for, but greater than 6 millimeters, which is about the size of a pencil head eraser.
Right. So that's definitely it's often better to have pictures so you can actually see what they kind of look like too.
Yes.
Because you may see a spot on your body and not really know what's going on. But best advice is if they have something they're worried about, they definitely need to call a dermatologist and let a dermatologist take a look at it.
Yes, the key to melanoma and even squamous cell skin cancer is early detection, early treatment. That gives you your best option for being cured from the cancer.
One thing we see with women as we age, spots do just occur on the body. And so many women are concerned about these spots, whether they're dark spots, and they ask, are these aging spots? You have rosacea that may come into occur and other things. So just take a few minutes and maybe talk about that and what women can actually, and men as well, get them, but what can be done about those, or are they just permanent for them?
Well, no, there are a lot of things that we can do, and a lot of it depends on what the places are. There are what we call angiomas, which are blood vessel moles. They are small little red moles that people get, and they're inherited. They are not sun-related. and we can laser those very easily and treat those. There are solar lentigos, which are cousins to freckles, I call them. You know how freckles are brown, flat places?
Right.
Well, they usually fade in the winter and they'll get more obvious in the summer with sun exposure. Lentigos don't do that. They pretty much come and stay. So they're flat, brown areas that it can occur anywhere, most commonly face and arms and hands, as well as the shoulders. And those can be treated either with a light freeze, they can be treated with bleaching creams, and significant sunscreens to prevent them from recurring. Melasma is somewhat the same. That's more patches of brown skin that people will get,
Right.
and that has somewhat of a hormonal tendency.
Okay.
Those can be treated with bleaching creams as well. And then there's something that's kind of crusty called a seborrheic keratosis. They're brown, gray, crusted areas, and those can be frozen as well.
Okay. Now with the bleaching creams, do they have to keep using those, or will they be able to stop use of those?
Typically what you can do is use those for up to 3 months for a period of time and then back off and not use them as commonly. New places though will develop depending on your sun exposure. So wearing sunscreens is critical.
Okay. And so if they did not protect themselves after that, would that place just come back? Would it be darker perhaps?
Not particularly darker, but many times they will recur.
Would recur.
Yes.
Okay. So definitely want to protect yourself after you get rid of it.
Yes.
And one thing with women too that's really easy, men may not have this convenience that we have, but the makeup that's out there now, moisturizers and even the foundations and things like that have SPF in them. And so it's easy for the women to especially protect their face. Do you encourage women to do that?
I do, but I like people to be very cautious because sometimes companies will put sun protection factors on their makeups to really be a marketing ploy
Right.
and not a quality sunscreen. So you have to be cautious with that. You also mentioned rosacea earlier, and that is the tendency to have the redness or pustules, dryness or excessive oiliness of the face,
Right.
particularly with adult women or adult men. And they cannot tolerate chemical sunscreens, which are the most common sunscreens.
Okay.
Those chemical sunscreens work by absorbing the heat of the ultraviolet light and preventing it from penetrating the skin. Anything that heats up the skin with rosacea patients will flare their redness and their bumps. And sunblocks, which have like either zinc oxide, titanium dioxide, they work by reflecting the ultraviolet rays. So for rosacea patients, you definitely do not want to use any chemical sunscreens.
That's very good advice then, because I haven't ever heard that either.
Yes, it's really important. Now, some of the new makeups that are mineral makeups, those are sunblocks. So they're wonderful options for rosacea patients. But typically, I like them to also use just a sunblock before they apply that makeup.
Okay, so sunblock first and then the makeup.
Right, that's right.
And how often throughout the day do you kind of suggest that they reapply the sunscreen if they're going to be outside a lot?
Well, I tell people if you're going to be out, you need to reapply every hour.
Okay.
And I hope for every 2.
Yeah.
But sunscreens, people think I put it on in the morning and that's all I have to do, and that is not how they can work.
Right.
So you have to really had some adjuvant care with the sunscreen use.
And what about those babies that are out there? We know more now, so if we can start earlier,
Yes.
protecting our children.
Yes.
And so what about for babies? What SPF would you recommend for babies?
Well, before 6 months of age, they do not need to be in the
Right.
sun because they really cannot use sunscreens. But after that, I recommend 30 when they're really young as a sunscreen, and then reapply every hour. And then there are wonderful sun protective clothings that are out now. They're rated by a UPF, ultraviolet protective factor, different than SPF. It really is a factor that tells you how many of the ultraviolet rays penetrate that fiber. And there are multiple websites you can go to. There are some local places here that carry UPF clothing for children and adults. So that's something else that's really nice to use for children, that they can put the clothing on and know they're a little more protected.
Right, definitely. Well, that's some great information, and we have plenty more to talk about. We're going to take just a short break, and we'll be back again to discuss skin cancer. Welcome back. Today we're talking about skin cancer, and we're joined by Dr. Evelyn Jones, and she has given us some great advice and educated us a lot on different types of skin cancer and different skin conditions. And so let's talk just a little bit more about skin cancer, and if a patient came into your office and you were to tell them they had a type of skin cancer, what advice would you give that patient in looking forward towards treatment or questions that they should ask their doctor before treatment?
Well, when you've been diagnosed with skin cancer, the most important thing to ask would be what type it is,
Right.
and what treatment is recommended. And then we know that most diagnoses of skin cancer significantly increase the risk of having another skin cancer within the next 5 years. So asking about what risk do I have of having another skin cancer, and what can I do to help prevent that from happening, or to decrease my risk down the road.
And how often would you recommend a person that's had skin cancer go back to a dermatologist for checkups?
Typically the first 5 years, I recommend seeing the dermatologist every 6 months.
Okay.
At that point, usually once a year.
Okay. And then for people that have never had skin cancer, do they still need to go to the dermatologist every year?
I do. I recommend that. I recommend that they evaluate their own moles once a month and look for changes, because they live with their skin and they can see it more often. And then have an annual dermatologist look at your skin. And it's interesting, at Wellsprings we have over this next month, the Skin Cancer Awareness Month.
Yes.
And we're handing out, one of the handouts from the Academy of Dermatology is a mole mapping sheet of paper that they can use to map their own moles. Whatever works for them, but they can usually get on the website for the Academy of Dermatology and find something that they can use to just track their moles, to look for changes, to document sizes. And then if they notice something, they need to go ahead and be seen sooner than their yearly exam.
Okay. So is that something that they would draw on when they were looking at their
Yes,
body?
yes, they can.
And then be able to tell you some of the changes that have occurred?
That's right.
Yeah.
That's right.
Okay. And that's the best thing too. We know our body's better than anybody else, so you definitely want to be familiar with your body and know what was there and what hasn't been there. Definitely.
Yes.
What types of treatment are available for the different skin cancers?
Well, obviously the most common is surgical removal,
Right.
and knowing that you get negative margins and removing it, sending it off for pathology so we get a definite diagnosis. There are some basal cell carcinomas that are real superficial that we can use topical chemotherapy creams for, or even radiation that we can use. And then we haven't really talked about precancers, but precancers are kind of a pink, red, scaly place that can occur, and those are treated best with either cryotherapy, which is freezing those, or photodynamic therapy, which is applying a certain medication to it and exposing it to light, or actually using one of the chemotherapy creams.
Okay, all right. And so we've talked about prevention. Of course, the easiest thing is sunscreen if we're going to be outside. But let's talk about other things we can do to protect ourselves. And so being out in the sun, when should we be out in the sun and when shouldn't we?
Well, some of that we can't control.
Right.
And that's why we have to always make sure we have sunscreen on and reapply every hour, and wear sun protective clothing and sunglasses and hats. But the most intense ultraviolet B light is between 10 and 3. And so you want to be extra cautious, try to be in the shade those hours. And it can be done. It's more challenging at some events like soccer games where there aren't many trees. But I can find shade just about anywhere. And so
Or take an umbrella, right?
That's right.
Yeah.
So those are the important things to do.
Okay. And what about hats? You know, we often see, especially guys like to wear baseball caps, but there's still skin that's exposed. So, you know, a wide brim hat that people may not like to wear, but we call them, you know, kind of like fishing hats.
Yes.
Those may be the best to wear, but what can a guy do to help if he's insistent upon wearing a baseball cap?
Well, one thing that I want people to realize too, even when they wear a baseball cap, not all of the sun is coming from above.
Right.
We get a lot of reflection off of the ground or the water or the pavement that is going to damage the skin. So whether you have a broad-brimmed hat or a cap, you need to really put sunscreen over your entire face, on your ears, the back of your neck, and just reapply every hour.
Right.
The UPF hats that I was talking about earlier are really nice because they not only have a broad brim and a wide bill that comes out, but they usually have a little flap that goes down the back of your neck.
Okay.
so that it protects the
The
posterior
back.
neck as well.
That's good. We often see men that come in for whenever we look at through a derma scan, which checks for sun damage. The men often have little places on top of their ears that they've never even noticed, and we'll say,
Yes.
"Well, look at your ears," you know. So
Yes.
definitely, guys need to remember to put sunscreen above their ears, and women as well, especially if we have our hair up or shorter hair. And then other things that they can do, of course, is wear, you know, clothing that, like you said earlier, which is great that it's even here available that they can get locally to protect them. And then also lips. People forget about lips. So what should
Yes.
people do for their lips?
Get a specific lip balm that has an SPF of 30 or higher.
30 or higher. Okay.
Yes.
And then you said wear a sunscreen with SPF of 15 or 30?
15 in general, 30 in younger age children, and if you're going to be out for a long period of time, 30 is probably better too.
Okay. And then we want you all to reapply every hour and hope for every 2 hours.
That's right. That's right.
Okay, well, let's talk just a few minutes then about tanning beds. We've talked a little bit kind of in general about it, but what are the specific dangers? You know, some people may think, well, it's indoors, it's, you know, artificial light, it's got to be safe, but you've said that you've seen more and more cancers from tanning beds, so let's educate people on tanning beds.
Yes, I can't say enough about tanning beds. It is alarming, more so than I've ever seen in my practice. A lot of it is over 1 million people a day will lay in a tanning bed.
Wow.
70% of those are Caucasian women ages 15 to 39. And so that's one of the reasons we're seeing such a dramatic increase in melanoma, the deadly skin cancer, particularly in younger women, even female teenagers.
Right.
We know that exposure to tanning beds before you're 35 years of age will increase your risk of melanoma 75%.
Wow.
And just exposure at any age will triple your risk of melanoma, the deadly skin cancer. The tanning industry has lamp bulbs now that emit 15 times the sun's rays in ultraviolet radiation. So the intensity is amazing. The tanning industry is a $5 billion a year industry, so a lot of money is spent on marketing, convincing people that it's safe. The American Academy of Dermatology has worked very hard to try to get stricter state regulations on minors and their use of the tanning industry or the tanning beds themselves. And we're hopefully making headway there, but the tanning industry is fighting us every step.
And one thing that some people are concerned about with different things that are released, you've talked about media, and you know the tanning industry does a lot too. But I was reading on a tanning bed, a store here that sells tanning beds. I was reading on it. They were telling people to come buy the tanning beds because they need vitamin D. Yes. And so let's talk a little bit about that. I call it a myth now.
Yes. That is very frustrating right now. And first of all, the media frenzy around vitamin D deficiency is really drowning out the true medical information.
Right.
We know adequate amounts of vitamin D are very beneficial to us. We know that it helps maintain prostate, breast, colon, ovarian health. It can help protect against diabetes and multiple sclerosis, even cognitive well-being in the elderly, arthralgias, myalgias. There's a significant concern there, and current evidence does suggest that there is in America a vitamin D deficiency, but it is almost exclusively in the elderly. And the elderly are not the ones that are going to tanning beds and sunbathing.
Right.
So to me, it is definitely a myth, and the hype is in the wrong direction. Vitamin D sources we get from fortified foods like orange juice and milk. We get from fatty fish like salmon, and then we also can get from supplements.
Right.
There is a small amount of vitamin D we get from ultraviolet B exposure. And what happens is when ultraviolet B rays hit the skin, they convert a 7-dehydrocholesterol into pre-vitamin D3 and then into vitamin D3. That is not an active vitamin, but that goes then circulates to the liver or kidneys and is converted to the active vitamin D. We know that in 2 to 5 minutes of ultraviolet exposure, the maximum amount of vitamin D that's going to be produced in the skin is produced. After that, any more ultraviolet exposure breaks down that vitamin. So the need to tan to get vitamin D is a total myth.
Right.
Just incidental sun exposure that we get walking into the grocery store and back, we're going to get our 2 to 5 minutes.
Yeah, or walking to the mailbox,
That's
taking
right.
trash out.
The Academy of Dermatology made a statement late in 2008 that stated they recommended vitamin D exclusively be obtained through fortified foods and supplements, and strongly did not recommend any unprotected sun exposure.
Good.
So,
Well, we hope everybody listening hears that, and maybe they can tell their friends about that too,
Yes.
because that is a hot topic sometimes
it is.
around.
It is.
And so the other things that are safe, if people just insist on having a tan, there is sunless tanning that's available for them, lotions and sprays, and they can even get that at your office, correct?
Yes, yes. It's really totally safe to use the sunless tanning creams. They give you great color. One thing I try to recommend to people, the ones that are out there now give you a very realistic look
Right.
to give you color to your skin, but they do not give you protection.
Okay.
So you still want to make sure you wear your sunscreens.
Well, would you just mind telling the audience today if they're interested in more information about the products that are available at your office or questions they may have for you, or maybe they need to come see you, if you could give your number so that they could contact you?
Yes, I would be happy. Obviously, that's what I do all day, every day, and I love to educate people, and I appreciate the opportunity to be here.
Yes.
But my practice is Wellsprings Institute. It's in the building with Energy Fitness, and our number is 554-SKIN or 7546. And we see patients every day except Fridays.
Okay.
We have a lot of products in the lobby area that are just products we've researched, we've studied, that will improve the health of the skin, give you some safe color, but also protect you as well.
All right. So what's the one key message you want people to take from what you've talked about today, which is a lot of information?
Oh, I think one of the things that I'd like to say the most, just if you look back, we have recommended the same things for years to prevent skin cancer. And so I just encourage people to listen, but adopt lifestyle changes.
Right.
Because doctors can study and research and make sound recommendations, but only you can change your life and your behavior and protect your skin, and mentor to your children and grandchildren what's important to really control your health. So be accountable, don't listen to the media frenzy, and be responsible, and don't tan.
Yes. Well, Dr. Jones, you've been a pleasure speaking with today, and you've educated me as well, and it's just been a joy to hear everything that you've had to say. So thanks for joining us today. And if you have questions about today's program, you can call Dr. Jones' office, or you could call our office at 442-1310. Thanks for joining us today, and remember, protect yourself from the sun.